But thanks everyone for attending my talk. That will be about, I guess, the whole scope of my PhD project. So I'll just be walking you through the work that I've completed on my PhD so far that some of you have been following already. And I'm hoping to get some feedback and a discussion regarding some of the next steps. So this research has also been supervised by Kirsten, Nicole, and Teresa. And my research is on the impact of institutional logics and work design on worker experiences of anomie. And I'll define these concepts as I go through the presentation. Before we get into the specifics, I want to draw attention to this quote that was provided by a witness from the Australian Royal Commission into Aged Care Quality and Safety. So this witness says, "A lot of the people I work with are much older than me and they tell me to get out and save my back. If there were more staff and better equipment, I might stay in aged care, but management refused to acknowledge that there is a problem." So from this quote, we can see an example of a situation where staff are facing difficulties at work, yet there doesn't seem to be immediate solutions to their problem, as calls for support are ignored or neglected by those in seeming positions of power. And aged care has been known as an industry that's notorious for where workers are overworked, undervalued. And there is an allusion to a systemic problem occurring within this industry that's creating negative outcomes for workers. Yet we also know that this is not the only industry where certain types of workers feel neglected. So thinking about this, in our research, we're seeking to understand what are the relationships between these broader systemic factors, and we use institutional logics as a lens to do that, and negative worker outcomes such as strain, counterproductive work behaviours, and anomie. And we want to determine whether work design mediates the relationship between institutional logics and these outcomes. And we specifically focus on the population of frontline workers in residential aged care. When we consider systemic factors, we use this theory of institutional logics, which is rooted in institutional theory. And institutional logics are defined as the guiding rules, assumptions, and social constructions which operate together to create the inter and inter-systems that are part of an organizational field. And we use this theory of institutional logics to try and understand what are these systemic influences that are impacting frontline workers in aged care. So just to provide an explanation of how they work, they can be conceptualized as a set of principles when analyzed together form a systemic norm. So researchers in this space have come up with a typology for institutional logics. They call them the ideal types. For example, in the top row, we see that there are types such as market, state, community, profession. And then on in the rows, we see that there are various elements that, when combined together, create that logic. So, for example, there is a root metaphor, there's a source of legitimacy, and all of these aspects ground this logic in reality. So a market logic, for example, relates to market capitalism, where transactions, share price, and free market status is deemed important, and so on and so forth for each of the other logics. And these logics can be either complement each other, compete with each other, or negotiate to impact an organizational field. So just to kind of explain how this works in terms of an organizational field, if you look at aged care, we can perceive the industry as made up of all of these components. We can see how the structures, policies, and practices influence the organization or influence this organizational field and work together to impact, actors in the field. So, for example, what is the role of a regulatory body in aged care in influencing this basis of strategy, for example, as we see here in the columns? And how does that component of the logic than impact workers. So we also consider what is the connecting variable between systemic issues and the on-the-ground day-to-day experiences of workers. And that led us to consider the role of work design. So good work design has been shown to influence the quality of work for workers and can impact worker motivation and job satisfaction. And work that is designed poorly, such as mechanistic work design, for example, can result in negative worker outcomes. And one of the negative work outcomes that we're interested in is this theory of anomie, is this experience of anomie. And this theory developed over time throughout the research program, but has become a core part of our theorizing. It describes the negative experiences that workers might have in reaction to social devaluation and hones in on market logics in particular. Anomie has been defined as an interaction between the state of a society and its impact on a collective experience. Strain theory defines it as occurring when structures within society don't provide the resources to be able to achieve the stated cultural goals. And we kind of apply this to organizations. And we also use a psychological definition of anomie. So Tamori and colleagues defined anomie as having as being a feeling of hopelessness, helplessness, which can result in deviant behaviour. So an example of this in aged care occurs when nurses ignored policy to dedicate specific hours to different patients based on their care package in order to meet the requirement of caring for those patients who are in need. And this is technically a deviant behaviour. However, it was required in order to meet the stated organisational objectives. Psychologically, also manifests as a shared perception of a breakdown of social regulation and social integration, and as a shared perception of a breakdown of leadership and the social fabric. And so within aged care, this can look like a mismanagement of aged care services through a system often termed a maze with no clear and consistent management structures. Putting together all of these variables, we design a conceptual model that we researched throughout the PhD program. So we propose that market state professional logics at the field level impact anomie, job strain, and counterproductive work behaviours at the individual level, and that at the organisational level, work design potentially mediates this relationship. And we tested this model through 4 studies. We started with a meta-analysis, then we did a qualitative case study, an experimental cross-sectional study, and lastly, a cross-sectional correlational study with different populations. So one with managers, one with frontline workers. So we first sought to explore the factors of logics and work design at a high level in study 1. So the purpose of the study was to understand whether there were systemic differences between comparable industries in the relationships of work design and work outcomes. So to do this, we used a meta-analysis and we compared the strength of the relationship between job demands, job resources, and job strain on the outcome of quality of care and counterproductive work behaviours, such as abuse and neglect. And we measured these relationships in 2 settings, so hospitals and residential aged care homes. And we figured that if we could compare 2 relatively similar industries, but we found that the relationships between work characteristics and job outcomes was different, then perhaps there were superordinate organisational factors that could account for these differences, such as market and professional logics. We screened over 12,000 papers and we ended up with 42 papers in the end, yielding 55 effect sizes. And we found in our main effects that job demands, low job resources, and job strain had a negative relationship with quality of care, and that job demands and job strain had a positive relationship with incidences of counterproductive work behaviours, and this was across both hospital and residential aged care settings. And importantly, we found that in aged care, the relationship between low job resources and quality of care was stronger in aged care settings compared to hospital settings. And so this suggests that there are differences in work characteristics between these two settings, and that these differences may be exacerbating negative outcomes, such as low quality care in some industries or working units. And it provides an initial indicative support to underpin future investigation into market and professional logics assumptions in residential aged care. So this kind of led us to our next study. And while we were studying aged care, unfortunately, COVID-19 was spreading. And this heavily impacted residential aged care facilities. We saw that there was a field-shaping event that was taking place in the industry, and that, I guess, allowed us to engage in a discourse with the space through the publication of media articles and other kind of grey literature that we could then study as part of a qualitative discourse analysis, I guess. We didn't do discourse analysis, a very small type of discourse analysis through a case study. So in the case study, we collected news reports, opinion transcripts, transcripts from the Royal Commission, and also reports from the Aged Care Royal Commission that discussed the COVID-19 outbreak in Victoria and its impact on aged care workers and residents. And we engaged in a thematic analysis, but also we used institutional logics as our theoretical approach to study the systems within aged care. So in the first phase, we used sort of a pattern matching abductive approach where we matched the themes that we came across to the institutional logics featured in the ideal typology. And we also looked for any emerging themes related to worker outcomes. And in our thematic analysis, in our coding, we saw developments related to this theory of anomie that I spoke about earlier. Yes. So then in phase 2, we used a pattern matching deductive approach to code theoretically salient themes related to this idea of anomie in our data. So we went through 2 phases of coding. And so briefly, we found that there were high incidences of abuse and neglect reported in response to workers not having enough resources during COVID-19 outbreak. There was a strong market logic. There was a weak state logic. There was a weak professional logic, and there was a fragmented community logic. So to sort of describe this briefly, what we saw was that the state regulation of aged care was lacking, and as a result, providers were not able to support staff and residents. And so they engaged in cost-cutting measures, which placed pressures on workers where they were not supported. And there was the discussion of these workers was that they were poorly paid Certificate 3 educated personal care assistants. And so they were kind of neglected in this space. So we saw, looking at these themes, that potentially there was relationships to this theory of anomie when we went back to literature and sort of tried to understand what was going on. And we saw that in aged care, that this breakdown of social regulation, integration, and feelings of hopelessness manifested through these strong market logics. this weak regulation and social support, that is the weak state, professional, and community logics. It was a field where individuals were deemed low status by society or devalued and were being neglected. And it resulted in deviant behavior or perceived deviant behavior. And so we recoded the data with this theory of anomie in mind, and we found that anomie manifested through a lack of transparency linked to market and state failures. So there was, cost shifting, there were unclear transparency around how funds were being managed in aged care, as well as the state sort of refusing to publish where there were issues within the industry. There was anomie through underfunding linked to market pressures, as well as anomie through weak leadership linked to competing market and state logics. So based on these findings and on the synergy between what was occurring in aged care and the theoretical construct of anomie, we came up with our own model to describe the interactions between economic forces, the devaluation of workers, and its relationship to experiences of anomie. So looking at this model, on the x-axis, we have a spectrum between low economic and high economic work role status, which is how close to the financial operations of the organization is the work role. And on the y-axis, we have a spectrum between low economic and high economic server user status. That is how much relative money is being provided by the service user to the product and how lucrative is the economic venture. And we propose that workers who work in a low economic role servicing users who don't have many funds to provide may experience high levels of anomie in their work. So from this work so far, we've established that there are systemic factors associated with setting that impact worker outcomes through job strain, that there may be an influence of market, state, and professional logics on worker outcomes, that this may be associated with the concept of anomie, but now we need to turn to the potential mediating factor of work design. So in study 3, we look at this and we also realize that so far we've conceptualized these constructs through qualitative analysis, but typically in psychology, we also want to test these in a more concrete way. So in study 3, we developed scales to measure logics, and we start to test our conceptual model by incorporating quantitative analysis. In this study, we explore the relationship between institutional logics and residential aged care and its influence on work design decisions and work outcomes. And we used a mixed methods approach, looking at a quantitative experimental study, a qualitative exploratory study, and a quantitative cross-sectional study. But we won't, for the purposes of this presentation, we're not going to focus on the qualitative part. So in the first part of the study, we conducted an experiment with university students, and we randomly allocated participants into a high market, low market, and neutral vignette condition. And each vignette asked the participants to imagine that they had been hired to work as a manager for a particular aged care facility. And we immersed the participant in the day of the life of a manager by explaining the specific values, aims, and objectives of the facility, which were manipulated to adhere to specific logics of that condition. And then at the end of the vignette, participants were asked to design jobs for personal carers and their direct supervisors, which align to the organizational objectives. And again, the objectives are manipulated to relate to either a high market or a low market logic. So this is an example of what the work design task looked like. So they were required to choose a total of six tasks from a list of 10 tasks together that formed the personal carer role. And 5 of the tasks were designed to represent mechanistic work, and 5 of them were designed to represent motivational work. And so depending on what tasks they chose, we tallied that up with a higher score representing more motivational work compared to a lower score. And so we found that there were significant differences for the personal carer role we found that there were significant differences between high market and low market conditions, with more motivational work designed in the low market condition. And for the supervisors of personal carers, we found the same thing between the high market and low market condition, where in the low market condition, the work was designed to be more motivational. But we also found differences between the high market control condition as well, for the personal carer role, again, with work being more motivational in the control condition compared to the market condition. And so this suggests that market logics impact work design to be less motivational and more mechanistic. In the third component of this study, we developed scales to measure state market professional logics in aged care and asked managers in aged care to report on the prevalence of these logics in the organisation. And we asked them to rate the quality of work for personal carers, as well as their perception of the value of personal carers. And we hypothesized that state and market logics would be associated with increased work evaluation and increased poor work design. But we also wanted to query the role of professional logics. So did the professionalization of a role, that is the esteem and support of that work role, moderate the relationship between market and state logics and these outcomes? And particularly for state logics, it could be the case that state logics could place further pressures on staff if regulatory policies are aimed at creating more administrative and compliance checks, which workers bear the brunt of. So in that sense, we hypothesized that the relationship between state and market logics and these outcomes would be stronger when professional logics are low and reversed when professional logics are high. And we found for the main effects that a market logic was significantly associated with worker evaluation, and that a state logic was significantly associated with poor work design, but negatively significantly associated. So a high market logic, is this correct? Is it negative or positive? I'll have to double check the direction of that relationship, but it looks like, yeah, so high market logic impacts worker evaluation, and the negatively, according to these statistics, I'll have to double check, and the state logic impacts poor work design negatively as well, but no significant moderation effects for this study. So I'll just quickly go through the final study, which we measured those relationships as well with workers this time, so with frontline workers. And we looked at the impact of market logics and state logic on anomie, and we looked at the mediating role of work design and the moderating role of professional logics. And so again, we collected data through Prolific, and we found that state logics, in the main effect, state logics was associated with more poor work design, so greater poor work design, which was contradictory with what we found with the management study. And state logics also created feelings of anomie. And there was also a positive relationship between poor work design and feelings of anomie. In our moderation, we found that the relationship between market logics and poor work design was determined by professional logics. So when professional logics were low, the relationship between market logics and work design, poor work design, actually decreased. So, I mean, even though it starts from a point where they're low for both professional logics, they start off with, if your professional logics are low, you start off having poorer work design if market logics are high. However, they increase faster as your professional logics increase as well, or the relationship is stronger. So. And we also found that there was a significant interaction between market and professional logics on anomie. So that is when professional logics are low, the relationship between market logics and anomie is significant, but it's no longer significant when professional logics are high. And in our moderating mediation effect, we found an indirect effect of the market logic on anomie through poor work design only when professional logics are low. So what essentially that means is that it is only for those workers who experience low professional logics that the impact of the market creates this feeling of anomie. But for workers who have medium scores and high scores in professional logics, that association doesn't exist. We didn't find any mediation effects between state logics in these outcomes. So just in summary, looking at all this research together, we have some understanding now of this lower left quadrant. That is, yes, for workers with low professional logics, the relationship between market logics and experiences of anomie are present, and that day-to-day poor work design could be a contributor or mediator by which these experiences manifest. And yeah, I'm just thinking about time and just going through the limitations and the next steps. Just wanted to acknowledge that our understanding of this phenomena is heavily shaped by the theoretical constructs that we utilised. It's still a complicated construct that still needs to be better defined. Also acknowledge that the effect sizes are relatively small, and so is our sample, and the limitation of generalising to other settings. And also we did have some mixed findings with this work design mediation. So perhaps there is a third mechanism or related mechanism that could explain the relationships better. And in the next steps of our research, we would love to refine anomie and the institutional logic scales and measure the phenomenon in different settings, and to see whether experiences of anomie exist in different quadrants of the economic model and whether it manifests differently. Again, to query other moderating or mediating factors that could explain the on-the-ground experiences of anomie and explain the role of state regulation in mitigating effects of the market logic on frontline worker experience. So where does it help and where does it hinder?